Dr. Robynne Chutkan, welcome back to the Sakara Life podcast. So lovely to see you again.
It's so good to be back with the two of you. Thank you so much for having me.
For those of you listening, we have had Dr. Robynne Chutkan on the podcast at least once or twice,
definitely
if not
twice.
more.
This might be the third or fourth time. We'll have you on indefinitely, though.
Oh, I love it. Can I come on every month?
Please.
I know.
So good.
And it's because you are one of the leading experts in the gut microbiome, and we love your perspective. And in the past podcast, we've talked just more, I'd say more generally about the gut microbiome and gut health. And in this episode today, we want to get into the depths of the gut-skin connection. And you and I have talked about this on your podcast. So excited to be talking about that today on the Sakara Life podcast. You know, we like to start off every podcast with the same question, which is, what is your mission here on Earth?
My mission is to make myself unnecessary, to give people the tools to understand their gut and to take care of their gut so that they don't need to come see me as a gastroenterologist. So to become superfluous and unnecessary and completely unimportant in people's lives, and really to connect the dots for people, to remind people that they have so much power. I mean, we can't fix everything that goes wrong with our bodies with a kale salad and green smoothie, but to remind people that they have power. And so much of that power to improve and to change your health comes from their gut and the things that we do to really take care of our gut. You know, when folks come to see me and are telling me about their small intestinal bacterial overgrowth or their Crohn's, I am often really kind of focusing in on their skin. And it's so a couple of times people have called me out. They're like, hey, aren't you supposed to be my butt doctor? Like, why are you so obsessed with my rosacea or acne or hyperpigmentation? But it really is because I'm not just a frustrated dermatologist. It really is the connection between the gut and the skin. And it's not an obvious connection for everyone. So the first thing I want to just point out to people is that when you put something on your face, it gets absorbed into your body. And when you eat something, it also gets absorbed into your body. So when things are inside our gut, they're not actually in our body. They're in this long tunnel, this hollow tunnel that runs from our mouth to our anus. It has a very thin membrane. And the whole point of this gut intestinal lining, the membrane, is to selectively decide what gets absorbed into our body, into the bloodstream. We have the exact same thing on the skin. We have a membrane, our skin, and we have different layers, the epithelial layer, subepithelial, etc. And that membrane selectively decides what gets absorbed through our skin. And there's so many similarities, the immune functionality, the microbiome, so much of it. So I always like to think of the gut as sort of the inside of the skin and the skin as the inside of the gut.
So are you basically saying what we eat is like skincare for our insides?
100%. And for a long time, I was only into this, like, I'm only putting things on my skin that I can eat. And I bought my office here in DC from my upstairs neighbor, Dr. Tina Ulster, who's like dermatologist to the stars here in DC. And she's actually was one of the pioneers in laser skin surgery. So she's this kind of unique combination of she's written textbooks, but she's also sort of the cosmetic dermatologist. And she pulled me aside one day and she was like, sister, this only Manuka honey on your skin, you're in your late 50s, like you need to get over it. Like here is some vitamin C and a retinol, and do not eat them, but put them on your skin. Because she was like, so what do you do on your skin? And I said, well, I just rub a little Manuka honey and then I rinse it, with some Evian water. And she was like, no, not working. So it's aspirational, Danielle.
I love that idea, though, because we can spend so much time taking care of our skin, but not really understand. I think people still do not understand what the gut-skin axis is and how what we eat and the health of our gut actually impacts the health of our skin. So I think that kind of creates a clearer picture. But could you walk through kind of in a bit more detail, helping people understand like the pathways, the processes, the metabolites behind how your gut health equals your skin health? Like, how does that happen?
I would love to. And so to just sort of circle back to the previous question, it's not you don't just nourish your skin from what you put on it, you nourish your skin through your gut. And that's really the question and the appropriate question you asked. So in the GI tract, when you eat something, and actually that digestion starts in our mouth. It starts before stuff gets into what we think of as our GI tract with our stomach and our small intestine. So in the mouth, salivary enzymes, very similar to what happens further down in our GI tract, amylase and lipase start to break down starch and fat. And interestingly, those enzymes can start to be released before the food even gets into our mouth. Just the thought of food. You know, the idea when you talk about something mouth-watering, that's what it's referring to. It's referring to the salivary enzymes being released and sort of creating water in our mouth. And so the food starts to get broken down right away, travels down the esophagus into the stomach, and in the stomach, it gets churned up into these tiny particles called chyme. And that's also where more enzymes get released, like gastrin and pepsin, different enzymes break down the food. Of course, the stomach acid is released. And then the food goes down into the small intestine, and that's where most of the absorption happens between the duodenum and the jejunum. The ileum is not so much the last part of the small intestine, not so much nutrient absorption, but that's where things like B12 get absorbed. So one of the important points here is that every part of the GI tract is sort of specialized in terms of how it functions, the enzymes that are secreted, things that are absorbed. So in the duodenum, you get absorption of fat-soluble vitamins, A, D, E, and K. But in the ileum, way 15 feet down, you get absorption of B12. So very different things, and different processes affect different parts of the GI tract. So for example, if you have Crohn's disease, your ileum might be affected. That's going to affect your B12 absorption, but your vitamin A, D, E, and K are probably going to be fine. So this idea of sort of like a one-size-fits-all, not really, because it really depends on what's going on in the GI tract. If you have a duodenal ulcer, if you have celiac disease that affects the first part of the small intestine, the duodenum, you're going to get low iron, you're going to get different things. But let's assume everything's good and the food gets churned up, the enzymes get released, it gets pushed down into the small intestine. That's where the bulk of the absorption that you referred to, Whitney, happens. And again, we have this intestinal lining. It is literally one cell thick. It is razor thin. And a buffer on one side, on the gut lumen side, the sort of inside part where the food is, you have a mucus layer that's pretty thick. And the purpose of the mucus layer is to trap things like toxins, bacteria, pollen, to provide sort of a barrier to entry through the membrane. So you have the food, the trillions of microbes on the inside. The food is broken down through a combination of enzymes plus some microbes acting on things. It goes through the mucus layer. It goes through that one cell thin lining. And then right on the other side, we have the immune system. We have all those cells that are releasing cytokines and antibodies. So there is this incredibly close, literally like hand and glove relationship between the gut microbes on one side, then the gut lining, then the immune processes on the other. And one of the most fascinating ways that works is, for example, a very common bacteria in the gut called Bacteroides fragilis. We call it B-Frag for short. B-Frag is like a monitor that is surveying what's going on. And when B-Frag is like, uh-oh, Ebola, B-Frag literally kicks the wall of the gut lining, and that activates all these immune cells on the other side. It's literally like a physical, like, hey, wake up, time to make some cytokines, like we've got some bad dudes in here. So the bacteria act as surveillance, because when you think about it, we ingest stuff all the time. I remember my dad lives a couple miles up the road from me, and I often run up through the park and visit him. And he grows this green called callaloo. It's a green indigenous to the Caribbean, where we're from. Kind of like a cross between spinach and collards. And I ran up there and picked some and put it in a smoothie. And he didn't tell me that he had sprayed it with dare repellent. And then I had gone to work later that day, and I started vomiting. And of course, they just hook you up to an IV and are like, keep going. Like you have a few colonoscopies to do. But really, my gut, we ingest all kinds of stuff like that. I mean, that was pretty severe with the dare repellent. But that gut lining, if it's intact, protects that dare repellent from going through my bloodstream and getting to my organs and like literally potentially killing me. So it's so important to have not just the healthy microbes, but a healthy intact gut lining so that it can selectively absorb the right things, and then a healthy intact immune system on the other side. And some of the metabolites that the bacteria produce, for example, short-chain fatty acids is the one we're most familiar with. Those really guide the immune system. If you have adequate levels of short-chain fatty acids, you're going to have that just right immune system, not overactive where you're having an allergic reaction or an autoimmune disease, not underactive where you're unable to clear the infection or your cancer surveillance isn't working. You want it right in the middle. And a lot of the studies show that that depends on the level of short-chain fatty acids. And of course, the short-chain fatty acids are produced by fermentation of fiber. So it's all connected. It's a pretty incredible system.
So it sounds like you're saying that our skin health is really up to how well our immune system is doing and how how like tamed or in check inflammation is. Like I think people think 100%. Of skin health as like, I have a zit, so therefore there's something on my skin I need to fix. But in reality, you're saying actually it's your immune system that is helping dictate your skin health, as well as inflammation that can be coming from several, you talked about like the mucosal layer of the gut, et cetera. So your skin health, I think this is where people get confused because we go to a dermatologist for our skin. But in dermatology, they're not taught about gut health. I mean, Whitney has this story to a T where it was her gut that was not doing so well, and that's what showed up on her face.
Is it something I'm eating?
Yeah.
Is it?
And
could it be something?
You, right? Oh, of course not.
I mean, they literally said, no, that's an old wives' tale. It has nothing to do with what you're eating. Even still, I'm seeing top dermatologists out there in the world that are saying, oh no, it's not diet. Here, take some Accutane.
And there's so many studies. And actually what's even worse, here, take some antibiotics, which then are so deleterious to the gut. But that point is so important. And this is part of why I love what you guys do, because you're not just like putting great food and products out in the world, you're putting great information out in the world, and you really care about these things. So thank you so much for that. But really that point of the immune system, your skin has in addition to being somewhat sort of relegated, if you will, by what's going on in the gut, your skin has its own immune system also. And the same things that we see that are ruinous to the gut in terms of that gut immune balance, like the ultra-processed food, lots of alcohol, too much fat and sugar, not enough fiber, too many non-steroidal anti-inflammatory drugs, the things that destroy the lining. We see the same thing with the skin. We look at products that are things typically that lather a lot, the sodium lauryl sulfate things, all of those things that can affect the lining of the skin. And then now your skin is more permeable, and things that normally wouldn't be a problem, things that you could have on your skin and be totally fine, now you put them on and you have a reaction because now they're penetrating to those inner layers, and your skin immune system is going, what? We've got to mount an immune response. And then you think about autoimmune diseases like eczema and psoriasis that are so common. I mean, everybody's got eczema.
Yeah.
And so much
even
of it
kids.
Is because especially kids.
Yeah.
And so much of it is it's the diet and what's going on in the gut. And it's the fact that the skin has been compromised by products and things, and now it is reacting. It's fascinating stuff.
The skin is like, when I think about my kids, like the skin is one of the first places I look to figure out if something's going on internally. And Dr. Chutkan, you've been my first call when I'm worried. But, it's like, I think my youngest has a sensitivity to dairy, like a pretty intense one that we didn't know about. And I started noticing like he would get all of these like red bumps on his cheeks. He just looked, you could tell there was like a fire inside. Like there was just like...
He looked inflamed. The skin and the stool.
Yeah. Exactly.
And you and I have had, don't tell him when he's older. We've had many conversations about his stool, which I love having. But you're so right. And it's so important. It's like tea leaves, right? You've got to look at your kids. I'm like, you've got to smell them.
Yes.
You've got to check out their poo. You've got to really know what's going on? I remember when my daughter turned about 12 and she's like, privacy, and would close the door. And I was like, what? You're not letting me look at your
don't
poo
flush.
anymore.
Okay, we'll close the door, but don't flush.
Privacy, mama, which was really just such a sad moment. But these are such important cues. And, unfortunately, you are often not going to get that same advice from the pediatrician. And that's not to say you shouldn't ignore their advice. They've got lots of other good advice, but really understanding like what you're describing, Danielle, where he looks inflamed and those little red bumps, and then maybe he has gas that smells off and his bowel movements aren't quite right. That is such important information.
And then what about women in their 40s and 50s? How do hormonal shifts in perimenopause and menopause affect gut health and the skin?
Yeah, that's such a great question. And one of the things that I tell my perimenopausal and menopausal patients, and they're often not happy to hear it, because they come in and they say, I don't understand. I'm not doing anything differently from what I always did, and I'm gaining weight and I'm constipated. And I'm like, that's a problem. You're not doing anything differently, but your body is very different. So just as if we think about menarche, when our, sort of the beginning of menstruation and our reproductive years, and you think about, I don't know, like a 14-year-old girl who's just starting to menstruate, she can pretty much eat anything and she is not going to gain weight the same way. And then on the other side of that, at 54 or whatever age your menstrual cycle stops, you just look at food and you're like, how am I gaining weight? And I'm like just looking at the food. So the body is very different at those different times. The bowel movements are different, the hormones are different, all of it. And the skin is different. So if we think about what a 14 or 15-year-old girl is dealing with, or a boy, it's acne, typically. But you are usually at 45, 55, that is not usually the primary problem. There may be some adult acne happening, but it's very different. It's premature aging, it's hyperpigmentation, it's dryness. Sometimes it's rosacea. If the microbiome is disrupted, that's very common, although we can see that in younger people too. And if you even think about it in terms of dental health, I remember it was like a decade ago, I was saying to my dentist, I'm like, it's so great. I've not had cavities in, decades. And he's like, that's because grownups don't really get cavities. You get gum loss and gum recession. You get long in the tooth. It would be very unusual for somebody in their 50s to have a cavity. So different problems. And,
Wow.
Gum recession is not something that a 12-year-old has to worry about. They're worried about cavities. And a lot of that has to do with the oral microbiome and the changes in the microbiome over time. So the skin concerns of perimenopausal and menopausal women are really different. And a lot of that has to do with dryness. And we see the same thing in the gut. You have to massively ramp up hydration. I'm going to take a sip in honor.
Me too.
But at the same time, we're dealing with bladder issues of, urinary frequency and so on. So it's like you take a sip of water, you have to pee, lots of things to balance. But rather than feeling frustrated, as so many people do, I like to encourage people to think of this as a science experiment, right? Like, let's ramp up our hydration. Let's get our hydration to minimum half our body weight in ounces of water, which is what I recommend.
Eat your water, right? Those hydrating fruits and vegetables.
Eat your water too, for sure. There are many cultures that never drink water and are very hydrated. So get that hydration level up. See what happens with your bowel movement. See what happens with your skin. And I'm not saying, don't try products. Those are important too, but we really have to make sure we're laying that foundation for proper gut and skin health. And yes, the concerns are very different as we age, for sure.
So I think, like, for the people listening, I feel like a lot of our listeners are the types who understand that there's a connection, who understand the importance of gut health. And if they're seeing signs like skin issues or stool issues, they might go to see a functional medicine doctor, or maybe they do one of like those stool tests that you would kind of do at home. What are your thoughts on stool tests and gut tests? And then from there, like I want to understand, especially as it relates to food sensitivities, like when they test for IgG and IgA, because I think that's kind of polarizing. So yeah, what are your thoughts? So somebody, let's say, has rosacea or has, some skin-related issue or stool issue, and they want to go figure out what's wrong. What do you suggest?
Well, first of all, save your money from the GI map test or any of those other ones. And I say that because as a practicing gastroenterologist for almost 30 years, who's looked at literally thousands of those tests, I will tell you that it pretty much never dictates clinically my recommendation of what's going on. So you don't need a stool test for you to know that something is disrupted. And then more specifically, that stool test is not actually telling you the problem. That stool test is based on, they've looked at the organisms they can identify in the microbiome, which is we're up to a few thousand species, but there might ultimately prove to be hundreds of thousands of species. So there are lots of species that we can't even identify. And then again, it's not just a species, it's a metabolites, which those tests are typically not doing. And the metabolites can change depending on the environment, depending on your diet, level of hydration, stress, all of that. So we're getting this snapshot that's not really representative. And I just will say this very transparently because I don't know any other way to be, which is that often it is a conduit to sell you a lot of cures that are rarely ever the answer, right? So rather than think of this in this reductive way, like you're going to get the test, then you're going to get the cure. I encourage people to think of it, what is your body trying to tell you? What is going on? And so often it's something that you're doing that you probably need to not be doing. Like in the case of your son and the dairy, Danielle, like not tolerating the dairy. Or is there a product that you're taking that's disrupting something? Because our default setting, if we sort of do what we're supposed to do, is things are supposed to go along pretty well. Every now and again, something unusual does fall out of the sky. But I think people are really focused on what they have to add in and adding in more things. And, some of these things can help for sure. But so often people are not focusing on what it is that they're doing that's disrupting something and the feedback that they're getting in their skin or something else. So if we take the example of rosacea, which is so common and it's often misdiagnosed as acne and then treated with harsh topicals, either like a benzoyl peroxide or systemic antibiotics, which makes the problem worse. Because as you both pointed out, dermatologists are well-meaning and very trained in their field, but not in gut health. And so what happens is that typically creates a vicious cycle with the rosacea because the agents that they're using are further disrupting the gut. And I mean, one of my dearest patients, really wonderful woman, when she came to see me, her face was just red, like imagine diaper rash all over your face. And she was in her 50s or 60s. She had had a little bit of rosacea and then it had been suppressed with antibiotics. She'd been on, I want to say it was either Cipro or azithromycin or both for like 4 years. Continuously. And we worked so hard. She really worked hard. I was a cheerleader to get her skin back and her skin coming back to looking normal. It was like the triumph of my year. I'm like, I don't care what else I do because she was walking around looking a fire hydrant.
And what does that look like to get her skin back?
First of all, stopping the antibiotics. So she had to take a leap of faith with me because the antibiotics were suppressing things enough so that when she stopped the antibiotics, the skin was terrible. But when she took the antibiotics, the skin was just really bad. So first thing I said to her was, you've got to just go through this period where you're off the antibiotics and it is going to be terrible, but it's eventually going to get better. And when I say eventually, it was like 6 or 7 months where she's like, she didn't want to go outside the house. And I'm like, you have to go through this because what this is doing is allowing your skin microbiome to regenerate. You've got to let those healthy microbes come back. So number one, she had to stop the antibiotics. Not doing that is like trying to fill a bathtub with the plug out. You're going to get nowhere. Number two, she was using a lot of stuff on her face that was making it worse. Because remember, we talked about this barrier being so delicate, so fragile. So other leap of faith, I'm like, stop washing your face. And she was like, what?
In Korea, they're all about that skin barrier. In America, we're all about stripping it away and scrubbing and
scorched earth approach.
Yeah, and in Korea, they're all about building that skin barrier.
And they have beautiful skin for the most part. Yeah. And the food is also very different too. You think about fermented foods and so on, the diet, but not washing her face. And you're absolutely right, Whitney. It is like cleanliness is godliness in America, like you must wash and scrub and you're going to wash the germs away. So it's very challenging to convince her, but she was literally desperate. So I said, you are not going to wash your face at all. And she's like, what do you mean not wash my face? I said, at night, you're going to take a cotton pad, you're going to take a little Evian spray water, and you're going to wet the cotton pad and you're just going to wipe away a little bit of the excess oil. But what I explained to her is that a lot of the oils and the secretions from her skin, that was her skin custom making this stuff, trying to protect it, trying to protect that barrier, creating those lipids. And I'm like, you're stripping it away. So that was really challenging, but she did it. So I was like, no makeup on the skin. You can put on a little lipstick, a little eyeshadow, but no foundation, nothing like that. Literally no moisturizer. Because, and again, this is not my regular skincare recommendations, but for her skin was so damaged and she really just needed it to heal. I know there's something going around on TikTok. Have you seen this cave woman skincare or something?
Yeah.
Yeah.
No, what is this?
We're not going to get into
do
that.
basically nothing to your skin.
It's a young woman whose skin, and I apologize if I don't get this quite right, but from what I gather, her skin was really damaged by a lot of overtreatment from, products, dermatologists. She was dealing with severe acne, and she decided to just stop doing anything, washing, all of that. And then there's been a lot of back and forth about, it looks like she has clay on her face as the skin is regenerating, and whether it's real or there's clay on the face, I don't know. I try and stay out of these TikTok discussions.
But it's so interesting what you're saying, which is when we think about gut health, what we're really taking care of is that one cell thick layer of endothelial cells and skin that is between the world that we eat from the outside world and our immune system and blood. And it's and organs and everything. Yeah. And it's the same, the skin on the outside is very similar, and that we need to really take care of it. It's a barrier to things. It has its own microbiome. It has its own kind of mucus we have on the inside. We're creating
mucus, lipid layer.
Yeah. And
so well said, Danielle. That's exactly right. And kid gloves, right?
Yeah. And
for that.
And think of it as, I hear what you're saying when it's people want to add. And I think that's so true when it comes to skincare and supplements. But then when it comes to food, it's the exact opposite, where it's okay, so I did a gut test and it shows that I have IgG for, almonds and strawberries. So I'm not going to eat almonds and strawberries. Also, I'm going to try keto. Also, I'm going to make sure I get enough protein. It's they all want to talk about what not to eat. It's so much more seductive to talk about what not to do than to talk about actually make sure you're getting an abundance of plants, an abundance of fiber, an abundance of colors. But instead, I think it's in our human nature to say okay, give me the one pill that works, the one serum that works, and then the 50 things I shouldn't eat. And that feels for some reason
That's so true.
what people really think the secret recipe is. And Whitney and I know you say this all the time too, keep saying there is no secret actually. And the more you can just actually focus on eating whole foods and a lot of different colors, that's the secret. And there's no easy way to do that. We try and make it as easy as possible, but there's no secret. There's no easy way to do this. And I hear you saying that about the gut and the skin inside that we take care of, as well as the skin that we get to see every single day. And so this was kind of wrapped up in my question to you. I had 17 questions, so I'm sorry. But so you don't think we should do the gut test, but if I'm so curious because I did a gut test and it said it had IgG for I think it was almonds and a couple other things. But then some people think that means I might have a sensitivity. But then there's another school of thought that says, actually, you just ate that recently. And so therefore, so that your body does not attack it, it creates these quick antibodies that help make sure it goes through the intestinal tract without, causing an immune alarm. So what is your thought?
Yeah, I really want to address that. And I want to be more nuanced than just, oh, this is a waste of time. It's not worth the paper it's printed on. And I just want to finish up quickly with my patient. So in addition to not washing her face, I also really changed her diet. Green smoothie every morning, lots of fiber. She was one of these folks doubling down on protein. And eventually we got there, and it was literally like the triumph of my year. To your great point about the stool tests, I want to say that the science of the microbiome depends on all of us being involved. And so all of us thinking of ourselves as citizen scientists and contributing what we can. I mean, obviously there are issues around privacy and so on. And, the data, I personally don't really care if somebody knows what's, in my stool. That's not data that I'm that concerned about. But I really recommend that people do that through organizations like the American Gut Project that are using that data in an open access way for scientists around the world, and are publishing data like that American Gut Project study in 2018 that involved over 10,000 people from 45 different countries and asked this really important question: what constitutes a healthy microbiome? What are the factors that can create a healthy gut microbiome? And because they have this huge database, they were able to drill down and come up with the answer that you both know, and that Sakara really, I think, encompasses 30 or more different plants per week. And the last time I was on, as I recall, we took a meal, one meal, not even a day's worth of meals, one meal, and I think we were at 33 or something. So
yeah, you get upwards of 70 in a day, 200 in a week.
So good, so good. And so we know that from the American Gut Project data. So some of the commercial tests, I feel like it's just a conduit to then say, take this supplement, this supplement, this supplement, all will be well. Versus something like American Gut Project, where it can give you the information about diversity and so on, but we are not yet there with the science where we can provide a prescription for what you should do, but we're learning. So for example, we know that if we look at a condition like chronic fatigue syndrome, we know that it has a microbial signature in the microbiome, and the same for long COVID. And we know that because generous citizen scientists donated stool, and scientists were able to sort of establish this. And so over time, the same way we look at DNA, we'll be able to look at stool to help diagnose conditions. But the way it's being done commercially now, we're not there. And I think it leads to a lot of restriction, to your point, Danielle, with the diet, and a lot of just concerns about things we shouldn't be concerned about. In terms of the food allergy testing, which is really what you're talking about, the problem is that, yes, we make all these antibodies all the time. And particularly if somebody has an autoimmune disease, some people tend to make more antibodies. So oftentimes we're seeing this antibody because this is something you eat a lot of or you've eaten recently. It doesn't mean you're allergic. And so my recommendation, if people are concerned about a food allergy, is to actually see an allergist and immunologist, because I see a lot of patients who are coming from somebody who maybe is not as well informed about that, and then gets their test and has told them to exclude, these 50 foods. And I'll go through the list. I'm like, do you have a problem with blackberries? They're like, no, never. I said, no itchy throat, rash, nothing. And so they've eliminated 50 foods that are often healthy foods that they've never had a reaction to. And, you're also cutting out the joy, which is an essential part of the diet too, right? The joy of eating this bounty of foods. And so I'll usually counsel my patients, and most of my patients have autoimmune diseases. They have celiac disease or Crohn's or ulcerative colitis. And I'll counsel them that if they are not having an obvious reaction, and or like certain foods like processed soy, dairy, gluten, these are foods that tend to be inflammatory in people who have inflammatory diseases. There are plenty of healthy people out there who tolerate them. But in my subset of patients who are dealing with a lot of active inflammation in the gut, I tend to steer them away from gluten, and particularly gluten-free alternatives with a lot of emulsifiers. If you're in Paris and you're eating, you have access to great wheat, not sprayed with glyphosate, have a croissant if it doesn't bother you. But a lot of the products that we have here in the US, typically the highly processed soy, of course, the things with the emulsifier, so any kind of dairy-free, gluten-free, you have to be wary of the emulsifiers, which are probably worse for you. And of course, large amounts of added sugar, things like that can often be inflammatory.
I really like what you were saying about this idea when you were helping this patient with her skin, that they had to go through a worse time, because we hear that a lot where, somebody will be on the program for 5 days and they're like, I'm more bloated than ever. And it's like, well, what were you eating before? Because sometimes when you include more fiber, more phytonutrients, more whole food, more kind of like bulk of food, it can disrupt the gut, because as we know, every bite we take changes our gut microbiome. And so to be getting upwards of 200 different types of plants when maybe you were getting like 12 before can really cause a change in the symptoms of the gut and the gut microbiome. So if somebody is saying to themselves, and as they're listening, like, okay, I have some skin flare-ups sometimes, I really want to nourish my gut, I want to take care of my gut, I'm going to go for more colors, more whole foods, more fiber. Like, how much of a kind of, I guess we'll call it downtime, do you think is normal for people to expect?
I love that question. And I think a lot of that depends on, as you said, what their baseline diet is. But the thing I want to remind people is that there's good gas and there's bad gas. And good gas is you're eating a lot of fiber, beans. We don't have the enzyme alpha-1 galactosidase that can break down a lot of the cell wall in legumes or in cruciferous vegetables like kale and so on. And part of why they're poorly digestible or indigestible is because they're not really meant for us. They're meant for our microbes. They're there to feed our microbes. And so we get more sort of roughage left over to get fermented into those healthy short-chain fatty acids. And that process will produce gas. So there are things about, when I say good gas, are you in intense pain with it? Or is it just that you're bloated, you're uncomfortable, maybe having some gas? Make sure you're drinking enough water, because we want to move everything through. Try and eat those foods earlier in the day when the GI tract is more active. The GI tract tends to slow down at night. Once the sun sets, it works in cycle with the circadian rhythm. So if you're having, a heavy fiber meal at night, you may be tolerating that less just because the whole, digestion is slower, peristalsis is slower, all of that. So try eating things earlier. You could do your beans with a sea vegetable like kombu. You can soak ahead of time. Fresh as opposed to canned is often going to be better. Smaller portions. You can take a little bit of a digestive enzyme like Beano that can help break stuff down. So I almost never recommend to just stop eating those foods. But I think the preamble and the advice you give people is you might feel actually more uncomfortable. You might feel more bloated, more constipated. And I think a reasonable amount of time is about 2 to 3 weeks. And it depends a little bit too on people's anatomy. I talk a lot about the voluptuous venous colon, all the curves. We have a longer colon. It's down there in the pelvis where it has to compete for space with the ovaries, the fallopian tubes, the uterus. And we have a less tight abdominal wall because of lower testosterone levels. So all of that leads to more looping. And so if you're somebody who's prone to bloating and sort of bowel irregularity, you might have to go slower with the fiber. But I just, this idea that fiber is dangerous, like it's not dangerous. I can't think, short of a bowel obstruction, if you have a disease like Crohn's disease with a stricture, or you've had radiation and you have a known stricture, so short of some anatomical problem with a narrowing in your intestine, like this is not dangerous. This might be a little bit uncomfortable. You might have to make some adjustments. But in addition to how your gut feels, like whether you are a little bit bloated, think about how your body feels. I know I feel very different after I've had like a big kale salad or green smoothie compared to after I've had like a hamburger. Now, I might crave a hamburger, and I've been known to enjoy a hamburger from time to time, but I just feel differently. I just don't, it might be delicious going down, but I always ask people to focus on the afterglow.
Yeah.
I've never experienced a hamburger afterglow.
No,
so definitely not.
Regret. But I experience, like, even if I overeat, there's a place here in town in DC that has just these incredible kale salads, and they have all kinds of shaved fennel and different things in there. Yeah. And even if I eat too much, because it's a really large helping and I'm uncomfortable, it's a different kind of discomfort from the post-hamburger afterglow.
Absolutely.
That's
And
important
I think
too.
in this world right now, it's so easy to just be focused on protein. But, I did a gut test on my son early after his type 1 diabetes diagnosis. And I did the Tiny Health gut test. And what it showed was that some of his microbes were eating protein when they shouldn't be in order to make those short chain fatty acids. And their recommendation was he needed to be eating more starchy vegetable, more starch, more, resistant starches, oatmeal and different things like that in order to boost up the fiber content and give those microbes what they need to really be thriving and do what they need to be doing.
That is fascinating. And people will talk about that, the fact that on a more ketogenic diet, you can still produce short chain fatty acids. But I think that's a great example of microbiome testing at work in a positive way. And I'm familiar with that company. And also maybe to come back a year later, 2 years later. So it's not necessarily that you're going to act on it, although in that case you did. And you acted out in a way, Whitney, that was sort of counterintuitive, right? Because you think about type 1 diabetes, you don't necessarily think about the starchier vegetables and so on. So
no, it's easier to manage, blood sugars if you're reducing the carbohydrate intake. And, what's funny is I had a client reach out recently, as I was mentioning to you, where she said, oh, what do you feed your son? Because I'm noticing that I'm having insulin resistance. And so can you tell me what to eat? And I said, well, those are two very different things, eating for type 1 and eating for insulin resistance. You can have insulin resistance with type 1, but that's not the same thing like with type 2, which is usually more around insulin resistance. And so I recommended to her doing our level 2 detox to just kind of clean out her body, clean out her cells, liver, and, that following a more low-fat diet for not forever, but just temporarily to reset could be beneficial to her. And she was very confused about
she was
it.
Surprised, right?
She had been on a high protein diet, focused on high protein diet, not realizing that could be impacting, leading to insulin resistance when she thought it would be helping her blood sugar.
And we were talking about this earlier before we started recording, which is always where the juiciest bits of the conversation are, for sure. You guys have to do like a after the show or before the show. This idea too, that we've gotten so prescriptive in everything, right? We have a ring to tell us if we're hungover or tired. Or I joke with my friend a lot because she's really into her ring. And I'm like, so you need a ring to tell you drank too much the night before, you're tired or you didn't sleep well? I don't need a ring. I know exactly what. Or, you have the GPS and you're driving and you're like, don't know where it is. And you look up and you're like, oh, it's right there. If I looked away from my device, I would see what I was looking for. So part of the problem is that, this encouraging everybody to test all the time and to monitor. And you look at something like continuous glucose monitoring. In normal, healthy people, of course, continuous glucose monitoring is essential in type 1 diabetics, and in some type 2, it's important, and if not continuous, regular. But continuous glucose monitoring, I said it and I'll say it again, in normal, healthy people, there is no evidence that this is doing anything for anyone's health other than making them super nervous and worried and thinking they have insulin resistance because they saw a spike in their glucose after an apple, which is supposed to happen. Or really creating this hierarchy of food. So you didn't get so much of a spike after McDonald's, but you did after a bowl of fruit. So McDonald's therefore is better, because it's suggesting that this one thing that you can test and to some extent manipulate is really a comprehensive marker of health, and it's not. It's not in a normal, healthy person. Now, it's, of course, much more important in somebody with diabetes. So I also encourage people away from this sort of constant monitoring and testing and trying to be very prescriptive, because it rarely leads to better health.
Right. We know what we need to do to be healthy, like eat whole foods, get enough plants, make sure you get good sleep, hydrate, exercise, move your body.
Yeah, I think people think like it can't just be that. I had a conversation
that's really what people think.
with a friend. Yeah, I had a conversation with a friend earlier this morning, and she's a good friend, but really frustrates me because she is in her early 60s and she has retired and she is sitting a lot now. And she goes from sort of not doing anything to like CrossFit. And then she's injured. And then she's, and I'm like, how about some Pilates or yoga, walking in the woods? So she's been complaining for years about this pain and must be her kidneys. And I'm like, it's not your kidneys, trust me. So she goes to this doctor somewhere just randomly, and she sees a nurse practitioner who's like, well, why don't we get a scan? And does a CAT scan, which, by the way, she had 3 years ago, and they see all these cysts in the kidney, and the nurse practitioner calls her and is like, you need to see a urologist immediately. There's all kinds of things going on in your kidney. And so fortunately, the urologist tells her what was correct, which is, yes, this is very normal. If we line 100 people up against a wall, we're going to see cysts in the kidneys of 50 of them. And there are certain cysts based on the position, are they lower pole, et cetera, what they look like, that can be malignant, but that's rare. Cysts in the kidneys, just like cysts in the liver, are extremely common and normal. So for about a week before she saw the urologist, she was convinced that, she was going to die and her kidneys were messed up. And I said to her, I was away when all this is going on. And I said to her, I got back on a couple of days ago, and I was like, this is what happens when you go looking for trouble. I told her, I said, if you'd had kidney disease for 3 years, you would be on dialysis. You wouldn't be sitting here in front of me perfectly whole.
I need to ask about something because yesterday I got a question from a client for thoughts on parasite cleanses. Okay,
Danielle,
what do you think?
You and I have had some interesting discussions about that, given your you spent a lot of time.
She is an avid podcast listener. She listens to the Sakara Life podcast, so this question is for her. What do you think?
Okay. Well, I'll also recommend to her that she listen to the Gutless podcast too, because we did a whole thing on parasites. And it was an actual true story of a patient who he did have a parasite in the end, but I shouldn't have spoiled it in case she listens to it. But I will say that the majority of people who think they have a parasite don't, and many people who don't realize they have a parasite do. The problem with, diagnosing it sort of empirically is that the symptoms can be very nonspecific. Like you can have gas and bloating or rashes, or, you look at these lists of symptoms and they're very nonspecific. And if you are doing either antiparasitic agent, which are very much like antibiotics. They can a prescription antiparasitic agent.
This is my concern about them. Yeah.
Yes, like mebendazole and these things, they are very, very strong and they will remove healthy bacteria. So it's a problem. If you are doing something more holistic, you still have to be careful because like oil of oregano and some of these things can
it's
also
a strong
be harsh.
Antibiotic. Yeah.
Yeah, absolutely. Like a little garlic, no problem, psyllium husk, that's fine. But when you get into some of these cleanses and it's like 10 products, and I look at the products and I'm like, ooh, this is a lot on the GI tract. So what I recommend is if you think you have something, and you don't have to be anywhere exotic. We know from the Centers for Disease Control that 30% of people in the US have things, but they're also minor things. And sometimes they're things that are training our immune system. And I'll circle back to that in a minute. But if you're concerned, if you've had a significant change in symptoms and you're concerned you have a parasite, go and get an actual test from a clinically validated lab. I personally like to use Parasitology Center Incorporated. I have no relationship with them. They don't even know who I am other than they get a lot of stool tests from me. No relationship whatsoever, financial or otherwise, with them, but they're a reputable lab with offices in Arizona and in Mexico. And often what they will end up finding is a larval nematode, which means it's a nematode, a roundworm, in a larval stage where they're eggs. They're no actual worms, so they can't identify which one. And that typically suggests exposure. So in that setting, I don't usually recommend any kind of parasitic cleanse necessarily, but I will often put people on some like psyllium husk or a psyllium and acacia combination. I'll tell them to definitely add more garlic, because what that usually suggests is that there was an infestation. It's now passed. They still have some eggs, but this is not sort of the main thing, right? So the thing that I see here, the problem, is people overtreating with really harsh things, and then there's more disruption of the gut. And, just trying to repopulate can be really helpful because many of us are exposed to these things. In fact, for some autoimmune diseases like Crohn's and ulcerative colitis, decades ago, there were some studies from Ireland and elsewhere that suggest that if you, and please don't do this, anybody, this was in a scientific setting, but if you infected some of those patients with hookworm, it dampened the immune system. It was like a natural immune suppression because now your immune system, instead of reacting to your gut tissue and causing ulcerative colitis, was battling the hookworm, much milder condition, and it would act as a natural immune suppressant. Those studies were abandoned in terms of whether hookworm could be a treatment for inflammatory bowel disease because the hookworm infestation could become chronic, could lead to iron deficiency anemia, etc. So we were swapping one thing for another, and even though the thing was less bad, it wasn't effective enough. But it is one of the things that people point out that when we look at the hygiene hypothesis and Sir Graham Rooke's old friend hypothesis, that in kids, when our immune system had to battle more germs, our immune system, it was training for our immune system. And so those kids who were exposed to more childhood illnesses had fewer autoimmune diseases later on. And so this is also something to think about is, do we always want to be removing all of these things? Because our immune system needs that training to say, okay, this is there and it's okay. This you need to mount a little bit of a response to, and this is a major problem. The whole Goldilocks immune system we were talking about.
And so many people, I think, are just like on the lookout, like on the hunt for something that's going to make them feel even better and even better and even better. And like if you don't have really like these bad symptoms and you need to find the solution for it and doctors haven't been able to find it, I'd say don't go looking for trouble because your body likes to be in a homeostasis and these things are powerful antimicrobials like antibiotics. And it is difficult to build that system back up. And so can you strengthen your immune system and continue to build up those good bugs in your system that are not only going to help your gut and help fight against parasites, but are going to help you get glowing, beautiful skin and all those other amazing things that we talked about earlier in the podcast.
I do.
So true. This sort of foundational approach is so important.
Yeah. And I love what you talk about where it's like, you're from parasites to viruses, like it's all teaching our immune system, and we never want to bomb, our information centers, so to speak. I personally have found that like some herbal protocols have really helped with like my gut health. So I think sometimes, but only when you're working with someone who really knows, because it's exactly what you said, like some of these herbs, a lot of them have antibacterial properties. So it's like you maybe are trying to completely avoid antibiotics, but then you're very willing to like go on an herb for 6 months. And that can be just as detrimental to our gut. I think there's also this school of thought, which is to say that like parasites really come in and attach and thrive in decomposing unhealthy tissue and unhealthy environments.
Yes.
And so...
Yes, it's like weeds in a garden.
Yes, exactly. So instead of bombing the bad guys, like I'm using air quotes, it's exactly what Whitney said. It's like take care of your gut. Do the things that we know build a really strong gut so that your gut can do what it's supposed to do, which is get rid of the bad guys on its own. When we intercept and say like, oh, I'm gonna, and that's where like some of these herbal protocols I think can be really helpful because you add them to your food or, you might take a supplement, but it's very low dose. So it's like food therapy that can assist. But when you're talking about like big pharmaceutical protocols to like bomb your system, it's back to this idea of germ theory where it's like germs, parasites are the bad guys. And if we go after the bad guys, like we'll only have this great experience. And it's actually no, they're all teaching our immune system. They're helping take care of our gut. They're helping take care of our immune system. And so instead focusing on taking care of your own kind of fertile soil, I think is the best and safest approach, certainly.
I love
Have
that
you
mentioned
yourself seen like big worms come out of people?
Oh, yeah. I have somebody, I know, it was a lovely lady who helps my parents, sent me this video recently. And I was looking at it and I'm like, oh, that's fascinating. And then I was like, oh, this was my video. I was on Dr. Oz show showing this video like 10 years ago. That's why she sent it to me. But it was, I'll share it with you, de-identified, of course, any patient information. But yes, it was a segment on the Dr. Oz show a long time ago. And I was showing a colonoscopy I did, and you could see all the parasites. Now, keep in mind, a lot of these organisms are, very tiny. We can have protozoal parasites that are one cell. But this was actually somebody with whipworm.
Wow.
And we could see it. But I love what you said, Danielle, about germ theory, Pasteur's germ theory, which is this idea that a germ gets into your body and it makes you sick, versus terrain theory, Beauchamp, which says that the terrain, your soil, your gut soil, is disrupted and the germ takes root. And that was sort of the whole thesis for my last book, The Antiviral Gut, is, if I had to sum it up in a sentence, it's less about the potency of the pathogen and more about the health of the host. And we see that over and over again. I mean, think about COVID. On January 20th, 2020, the Diamond Princess departed Yokohama, Japan, with about 3,500 people on board. And of course, that first passenger index case, Mr. A, 80-year-old man, had pneumonia. And about 5 days later, 20% of the people on the ship had COVID. And of that 20%, 2% died. Now think about cruise ships. They are tiny. Like even the big stateroom on a cruise ship is like the size of a master bathroom. Like when there is a virus on a ship, it is everywhere. So everybody is exposed. But yet only 20% of people were infected. And of that 20%, some were asymptomatic, some were very sick, and 2% died. So this is literally, to me, the most important question of the 21st century when it comes to health. Why them? It's the exact same virus. It's not a different strain. It's not like this one got a more virulent one and this one didn't. It is the difference in the host who had taken a bunch of antibiotics and had a microbiome that was disrupted, and to your point, Danielle, ripe for something to take hold. Who was taking acid blockers that also disrupt the microbiome? Who had an ultra-processed diet and used a lot of artificial sweeteners? Who was stressed? All of these things that, are not just a coincidence. It's not just bad luck that these 80% of people didn't get infected and these 20% did. And these 2% died. And again, of course, not suggesting this is anyone's fault, particularly, all the suffering we saw from the pandemic and long COVID and all of it. Just that people are so poorly informed about these things. And it's disempowering.
Yeah.
Right? You tell people like, there's nothing you can do. There's so much that you can do. Simple things like being more judicious about antibiotics. And not just for gut health, there was a study, the Nurses Cooperative study, showed that women in middle age who use antibiotics for 7 to 8 weeks, not consecutively, cumulatively, over a several-year period, it ages their brain 3 to 4 years because of the disruption in the microbiome.
Wow.
And I read that study that came out about 3 years ago, and I was like, that is bananas. I thought about all these women I know who take antibiotics for their skin, who take antibiotics after sex to prevent urinary tract infections. I mean, fortunately for you, it was you're so, clued in and smart about that now.
But it's still something that I have to work on because I took antibiotics for so many years of my life. I'm kind of more perceptible to, different issues. So I have to work harder to keep my gut health in check. And it's something that I think about and focus on.
Seriously.
Yeah, I take it seriously.
I have that same experience as, with my daughter, who was a C-section baby, only nursed for 6 weeks, 20 courses of antibiotics by age 2, a very sickly child. And she's a healthy 20-year-old now, but she thinks I'm just sort of like obsessed about her food. But it's because I worry about all those antibiotics she got and being a C-section baby and her risk of autoimmune disease later on. And that's why I'm like, kale, and more kale, because of that susceptibility, right? And at the same time, I think there's a way to think of it as glass half full.
Yeah.
Like, it's terrible that happened, but at the same time, it's given you such an appreciation for these things. And like I see with my patients with autoimmune disease all the time, like so many of them are healthier than their peer group because they are eating, they're eating to live. They're not living to eat. They're understanding food as medicine in a really profound way. And of course, you understand it for your son also.
Yeah.
So I think the irony is that you're going to outlive us all.
Yeah. We've been forced to have the skills. Like, I was a C-section. I was never breastfed. My mom has this weird joke about how, like, I didn't want milk after a certain point. So she started giving me oatmeal at like 5 months old, which now we know, like, you look at the studies and it's like, that is so bad. It's like it's not good, you know? And so it's like, I will forever have to manage my gut health, like, so proactively, like it's my job. Because, you know, like, that was whatever lot I was giving, and I'm grateful for it. Like, I wouldn't be here without it. I have skills now where I get to really set my kids up for success in ways that, you know, my mom didn't know and couldn't.
And it's also the whole origin story of Sakara, which I love. I mean, I for those out there listening, I have no financial relationship with these wonderful ladies other than I adore them and I adore their company. Both your company as in your presence, as well as your company, Sakara Life. And the story of how this company was born out of, you know, Whitney, you dealing with skin issues, Danielle, you managing your weight and all of these things and having to figure out, like, let's just face it, the doctors were not helpful, right? Having to figure out, like, and not suggesting that doctors are not helpful, but in this particular situation, how do we feed ourselves to achieve the results that we want? And I love that you took this struggle, the struggles you had, and you made it into something like so beautiful and worthwhile and helpful for people. So thank you for doing that.
Thank you. I hope that through these conversations that we have, that people, a big takeaway from it is just how truly important the gut is, that it is essential to every part of the body, whether it's our immune system, preventing autoimmune conditions or working with autoimmune conditions, to skin and reducing premature aging or working on conditions like rosacea or acne, that what we feed ourselves and that it goes through this gut lining and all these microbes through this gut system, that it really makes an impact on us.
A huge impact. And if anybody out there is doubting, I always say, just look down at where your gut is located. It's right in the center of your body. It's literally the engine. But I do also want to say that you don't have to be perfect. I mean, I've talked a lot about kale salads and green smoothies and so on.
Eat clean, play dirty.
Absolutely. But the gut is also very forgiving in that, like, I always say you can overcome some cake and pizza with enough healthy stuff. So the idea is not about perfection and restriction, but it's about balance. And just like the microbiome, I mean, we have organisms in our body that are dangerous, but they're fine. They're present in low levels, they're controlled, and it's all about balance. So it's not about never having a piece of cake or some ice cream or a gin and tonic or whatever it is, but just making sure that you're getting in all those other important foods, multiple plant foods, and enjoying it, all of it.
So true.
And we like to end each podcast with light work for our Sakara Light listeners. Do you have a light work to share today?
You have to explain the light work.
So that's
a little bit.
It's just homework. What do you want our listeners to do?
Okay. For light work, I would love you to focus on 3 things, and that is dirt, sweat, and veg, and getting more of it. And so by dirt, I want you to get outside in nature. You don't have to get dirty, but if you can, that's fine too. And I also want you to think about the food that you're eating and eating food that's grown in dirt. So more dirt in your life, more sweat. And that doesn't have to be, like a marathon or CrossFit class, but just moving around and sort of getting tired, really moving those muscles, because your gut is also muscular structure. It's smooth muscle. And so it needs stimulation. So that's a sweat. And then, of course, the veg is kind of self-explanatory. More veggies. I really like my 1, 2, 3 rule: 1 veggie in the morning, 2 at lunch, 3 at dinner. You get in 6 for the day, or you can flip it as I usually do, because I usually start with a green smoothie. So I get a whole bunch in, sort of done, check, 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 taken care of. But there's so much more to add to that prescription. There's sleep and this and that, but I can only usually handle 3 things at a time. So my 3 are dirt, sweat, veg.
Love it.
Thank you, Dr.
Amazing.
Chutkan.
Always a pleasure having you.
We love you. Thank you.
Thank you so much. It's always so fun to be with you guys.